is our Socratic Circle video on esophageal cancer. My name is Victoria Borfeld, and I'm a double major in exercise science and dietetics.
I am Joy Sellers, and I am a freshman majoring in dietetics.
My name is Colleen McKinney, and I major in dietetics.
And my name is Hannah Linda Smith, and I'm double majoring in dietetics and nutrition and fitness.
Do you want to start us off, Colleen?
Sure. Okay, so let's just start out with what is esophageal cancer?
Esophageal cancer is the cancer that occurs in your esophagus.
All right, and what is the esophagus?
The esophagus is a long hollow tube that runs from your throat to your stomach, and it carries the food from your mouth to the stomach to be digested.
And where does esophageal cancer begin?
Esophageal cancer usually begins in the cells that line the esophagus. It can occur anywhere in the esophagus, but usually occurs in the lower part of the esophagus.
What are the signs and symptoms that you might have esophageal cancer?
Some signs and symptoms would be difficulty swallowing, unintentional weight loss, chest pain, pressure or burning in the chest, fatigue, frequent choking while eating, indigestion and heartburn, and then coughing or hoarseness.
And when should you see a doctor about any of this?
You should usually see a doctor when the signs or symptoms are persistent. You should also see a doctor if you are diagnosed with Barrett's esophagus, which is a precancerous condition brought on by acid reflux disease.
Now, what causes esophageal cancer?
Well, it's not quite clear what exactly causes it, but it occurs when the cells in the esophagus develop mutations in their DNA.
And how do mutations affect the cells enough to cause esophageal cancer?
Well, the mutations cause the cells to grow and divide out of control.
Are there different types of esophageal cancer?
Yes, there actually are several different types according to the type of cells that are affected and that are dividing out of control.
What are the different types of esophageal cancer?
Well, there are several different types, but the two main ones are adenocarcinoma, which begins in the mucus secreting cells.
And where does that occur?
It occurs in the lower portion of the esophagus.
And the second type?
The second type is the squamous cell carcinoma, and it affects the flat cells that line the esophagus.
And again, where does that one occur?
That occurs usually in the middle of the esophagus.
Okay, and the third type?
Well, there are several other rare types, such as lymphoma, carcinoma, sarcoma, and choriocarcinoma.
Thank you.
Who are more at risk for esophageal cancer in the U.S.?
Generally, men are more at risk for esophageal cancer.
Okay. What are the different risk factors involved?
There are many risk factors, including drinking alcohol, smoking tobacco, chewing or eating few fruits and vegetables, being obese, smoking, or being between the ages of 45 and 70.
Does drinking hot liquids put you more at risk?
Yes.
Okay. What are the different treatments that you can use for esophageal cancer?
The main treatment is getting surgery, either to remove the small tumor, to remove a portion of the esophagus, or to remove a portion of your stomach.
How exactly do these treatments help?
The treatments help because they provide supportive care at the hospital, relieving the esophageal obstruction, providing nutrition. You can get chemotherapy, or you can get radiotherapy, so all of those help.
Okay. Are there any serious complications that surgery can carry?
Yes, there are complications. Some being infection, bleeding, and leakage where the esophagus may have been cut off and been reattached.
How do you exactly receive treatments for esophageal cancer?
They usually base it off what type of cells are in the cancer and how you feel about receiving treatment, your preferences.
Okay.
What are the complications of esophageal cancer?
One complication is the obstruction of the esophagus, and this makes it hard and impossible to eat and drink. Another one is the advanced form of esophageal cancer, and that can cause cancer pain. Bleeding in the esophagus, though gradual, bleeding can occur with esophageal cancer, and at times the bleeding can be very severe. And severe weight loss, it's because you can't eat and drink because it's nearly impossible, so that causes a decrease in your weight. And coughing, the esophageal cancer, can erode your esophagus and create a hole in your windpipe, also known as your trachea. And this is known as tracheoesophageal fistula, and that can cause severe coughing.
What are some of the side effects of esophageal cancer?
Well, there are several different side effects, including having a poor appetite, which can lead to weight loss and difficulty swallowing, and also weakness is included in the side effects of esophageal cancer.
What are some of the things you can do at home that can help?
It definitely helps to choose foods that are easy to swallow, such as soups, yogurt, milkshakes, smoothies. It also helps to eat smaller meals more frequently rather than the set 3 meals a day. And also it helps to keep nourishing foods such as fruits and vegetables in easy reach so that you're more likely to choose them.
Is there anyone you should consult about what to eat?
Registered dietitians can talk to you about vitamin and mineral supplements because you probably won't be eating the way that you normally would be. So it helps to have these supplements in order to receive the nutrients that you need.
How could I reduce my risk for esophageal cancer?
Well, you can quit smoking, quit drinking alcohol, or drink it in moderation. Mainly that means 1 drink for women and 2 drinks for men daily. You can eat more fruits and vegetables and incorporate them into your diet, and you can maintain a healthy weight.
How would someone with esophageal cancer cope with their diagnosis?
Mainly you just become more informed about it. You can ask your doctors questions, you can ask friends and family, ask doctors for recommendations of who you can see, and different sources of information to cope with that. And stay connected to friends and family for sure.
In conclusion, esophageal cancer will usually occur later in life, but there are preventative measures that can be taken to reduce the risk. Those higher at risk should see their doctor frequently and discontinue their risky behaviors. People should also pay attention to their bodies and also take notice of any precancerous signs or symptoms. They can also become more informed about the cancer by asking their doctor. Esophageal cancer can usually be treated if caught in the early stages. We hope that this video is informative and beneficial for preventing, coping, and treating esophageal cancer. Thank you.